Hi, my name is Jennifer Clark, and I'm the Nursing Education Lab Coordinator here at the University of Massachusetts Dartmouth. Welcome to Accepted Students Day, and congratulations on your acceptance to the university. I'm happy to be here with you today, although I wish you could be here with us in person, but I'd like to bring you on a brief tour of some of our nursing laboratories. So let's start by entering the Clinical Therapeutic Skills Laboratory. This laboratory is a 9-bay skills lab. Students in this room practice many of the traditional nursing skills that you'll become familiar with. Today we have some sophomore level students who are learning how to assist patients with activities of daily living. They're currently, it looks like they're washing this patient, and they'll learn how to change the bed linens, how to reposition the patient in bed. They're practicing on one of our medium fidelity mannequins. Right now we have 2 of those mannequins in this laboratory. I can walk you around the space so you can see the various bays that we have. Our simulated patients in this room are always typically in their hospital beds. Each of the 3 sections in the lab have equipment that has the ability to simulate administration of oxygen, air, and also allow students to actually practice suctioning. I don't want to turn it on right now, it's a little noisy. It can interrupt our students who are working. At the center of the classroom here we have flexible seating areas. You'll notice that right now it's marked off for safety and social distancing. We have been on campus both in the fall and the spring semesters. We have guidelines in place that have allowed us to safely be here, practicing all of our nursing skills in the lab. This room here is our simulated medication room, which I'm happy to open the door and show you. It's designed really to replicate what you might find in an acute care setting in their medication room. So you'll look, as you see, look all around the room. There's shelving with oral medications, inhaled medications, syringes. We have vials of simulated medications here. Everything that we use in our lab is, of course, simulated, but they're also very realistic. So this is our supply closet. Again, just like the medication room, it's really designed to look like a supply room that you might find in the acute or even the long-term care setting. And it's set up in different categories. So for instance, this is all of our PPE. We have all of our face masks here, all of our gloves, all of our sanitizer, cleaning supplies. This area over here would be many of our respiratory supplies. Dressing change supplies are over here in this corner. So we really have everything that you would need to practice all of your nursing skills. Hello everyone. Hello. So here we have some of our students who are they're also practicing some skills. They're learning about enteral feeding and enteral medication administration, as well as some topical medication administrations. So this is a little bit different than the skills laboratory. As you can see, instead of having hospital type beds, we have examination tables like you might find in an outpatient setting. So this room is only about a year or 2 old. And you can find that we have all of the assessment equipment that you might find in an outpatient setting. Everything that you really can need. Students are generally introduced to this room in their sophomore year when they start to learn health assessment skills. This room is also used by our graduate students in their advanced health assessment course. So there are 10 bays in here for practice. Generally we have 2 students working together in pairs at each bay. And again, just like the lab that you saw previously, we have flexible seating in the middle of the room, which really allows us to do lots of different types of activities. You might take an exam in this room. You might work in a small group to do a case study together. And as in 203, as I should have pointed out, we do have a large monitor up there so that your instructors can show you videos. You can do Zoom group meetings. We really have a lot of flexibility in this classroom. So now I'd like to take you into our last major laboratory space. This is the Elizabeth Pennington Clinical Simulation Laboratory. So this is a high fidelity simulation space, meaning that it very much mimics reality. It's as close to probably taking care of a patient in a clinical setting as you can have without actually being in a clinical setting. So we have mannequins in these spaces, which I'm going to show you, that are controlled by our faculty members who sit at these control stations. They have two monitors. One monitor, they utilize software that allows them to control the mannequin. So they control the mannequin's speech, their breathing, their heart sounds, their lung sounds, their bowel sounds, their pulses, just about every feature that you can imagine. And then the other screen allows them to see you on video. So you're in a different room and your faculty member will sit here and they'll be able to see you on a video recording. So let me show you a sample of some of the rooms we have here. In this room we have a SimPan Essential mannequin. So this is an adult mannequin. And this looks very much like your typical hospital room. You have a patient here in a hospital bed. You have your simulated air, oxygen, and suction behind them. When this is on, this is your patient monitor, so you can see their vital signs. You'll be administering IV medications through the IV line that the patient has. This patient today, I think this is Miss Bloom, she happens to have a Foley catheter here. So you will practice taking care of patients with a variety of medical diagnoses in this room, and it's really intended so that we can provide for you a standardized experience of a situation that you might encounter in the clinical setting, or you might not. So you get to take care of the patient here, make mistakes, learn, be comfortable. You get to practice communicating and teamwork with your peers. And then what happens a little later is once you're done with your work in this room, and I'll show you that, you'll go down to another space and you'll sit with your small group and your faculty member, and you'll have the opportunity to really reflect on how you took care of the patient and your interactions not only with the patient but with also your peers. And this is called debriefing, and you oftentimes will be able to watch yourself on video back, which can be uncomfortable, but there really is a lot of value sometimes in seeing exactly what happened in the moment. So this is an adult room. We have 3 of these adult style rooms, and then across the hallway we have our pediatric room, and there is a Sim baby who is an infant, and then also a Sim junior mannequin. And it has all of the same features as the adult room, and I should point out, so there are the video cameras up on the ceiling there, and that is what is doing the recording that allows your instructor to see you in the other room, and also allows your peers to watch you live from a different room, and also how the recording is made that you might be able to view after your time taking care of the patients here. Finally, I'm going to take you down to the debriefing suite. It is attached to both our simulation lab and our health assessment lab. Again, this area was also recently remodeled in about the last year and a half or so. So this is what we call one of our debriefing rooms. It's actually just pretty much like a conference room, but our priority use for these rooms is for you to be able to sit in here, and sometimes on that large screen there, you will watch your classmates in the other simulation room with the high fidelity mannequins. This is also where you meet after your simulation session with your instructor, where you spend some time reflecting on what occurred. So we have 4 of these rooms. They all look very much the same. They just have different capacities. And again, we prioritize them for your learning in conjunction with your simulation activities, but we can also use them for many other types of activities, meetings, small group work, etc.